Hey Cam,
Hello.
how are you feeling after last night?
Went to many old fashions. Still feeling a little groggy this morning.
Not as easy as it used to be in
No,
residence.
definitely not.
Hi everyone, this is Painless Padilla and we are here with Dr. Cameron Bazmi, sports medicine aficionado from Toronto, Canada.
That's me.
Me and Cam go back to residency. He was my residency best friend.
Yes.
And then he left me for Canada.
I was kicked out.
Kicked out of the country.
I was deported, basically. I wanted to stay a little bit longer.
Did you really?
Yeah.
Were you going to practice in the States?
No, but I wanted to stay for a little bit longer, but, I was kicked out.
What was the biggest change working in the two hospital systems or healthcare systems
Between Toronto
the U.S. and Canada?
Well, biggest thing is that Canada is has socialized medicine. And so everything, or most things, are paid for by the government already. So kind of like Medicare here. But the issue is that everything takes a very, very long time. So MRIs can take up to 3 to 6 months to get ordered, especially like not urgent ones. And that we don't have a lot of specialists doing fun procedures that you do. So, and not a lot of people were doing what I do, like a lot of ultrasound, like stuff with the ultrasound medicine, injections, things like that.
Even those kinds of interventions aren't as prevalent?
It's not as popular, especially through PM&R. PM&R is like very classic PM&R, lots of EMGs, lots of neuromuscular, diagnosing neuromuscular stuff. And the only sports fellowship is through family. So family, you do 2 years and then you have sports medicine fellowship, but they don't do a lot of like...
Is that for like Canadian training programs?
Yeah.
What made you go to the U.S. for your training?
I didn't apply. I didn't apply to any Canadian because it's so competitive. Yeah, so a lot of people they're not formally trained in ultrasound diagnostics and injections. They just kind of learn as they go. They do a lot of courses. A lot of times these docs in Canada will come to the US to do the courses, and then they just start doing it back there. So, but they don't have the same type of training that we get here as a sports medicine fellow.
How do they hear about those courses? Like, there are a lot of societies and different kind of industry presence there.
Yeah, a lot of people will advertise it. Someone will do it, and then there's a few docs who have created their own courses in Canada as well. So then again, they just kind of like learn as they go, and then they've been doing it for a while, and then they just start teaching it to these younger docs who are now using it. A lot of it is based on just procedures. And not really doing like the diagnostic part of the ultrasound. So,
is PRP paid for by the government?
No. So the only thing that the government, medications are not covered under the government program. Yeah, they're not covered by like the OHIP, which is the government like Medicare funding.
So speaking of physiotherapy,
yes.
You studied kinesiology right before medical school.
Yeah.
What made you even decide to go into sports medicine?
So I was a swimmer. I did 4 or 5 times a week of training practices, and shoulders started hurting a little bit, and I was just told to swim more. Right? No one talked to you about stretching. No one talked to you about rotator cuff injuries or anything like that. My shoulders started hurting, and every time I would swim, like, just get worse and worse. Went to my family doctor, went to a physiotherapist, went to 2 physiotherapists. Nothing was making it feel better. I was finally referred to this sports medicine doctor, and he was a big sports medicine doctor. He still is a big sports medicine doctor in Toronto. And he had all these like athletes pictures on his wall, signed. He had a gold medal, like in his office as well too. He has all these people working out.
Gold medal for himself?
No, like from an athlete.
Just gave him one?
Yeah, I don't know. I always remember that. It was so weird. So then all these like, athletes, I'm like, this is so cool. And like within 2 seconds, he diagnosed me, with a rotator cuff injury. Which now looking back, I was like so amazed at the time. But looking back,
so routine.
Looking back is like I literally do this with my eyes closed now. So it's funny.
Do you still talk to that doctor?
No, I don't. He's now our main competition now.
Any people now that are like mentors to you or that you look up to or aspire to be? Clearly not it before.
No, just our old, my old mentor, Dr. Imam.
Dr. Imam, they love him.
So
Dr. Imam is now the sports medicine fellowship director at Johns Hopkins.
Yeah.
I remember the most important thing he taught me was stick the needle where it hurts. Right? Oh, that's true. Very, very good at diagnostic ultrasound, which I think is a skill that not a lot of programs teach.
Yeah.
And the skill that we don't always have the time to develop, at least in the States.
I think most of the sports practices, like sports fellowships, like it's now part of it. So you get a lot of Canadians who are coming down here doing a sports medicine fellowship and then coming back as well too. So the diagnostics is definitely the most important, but like in everyday practice, it's hard to use.
I feel like that's probably one of the biggest complaints or conceptions that patients have about doctors here. They're just like, oh, my doctor doesn't have time to talk to me.
Yeah.
They don't care. And really, it's like the system that forces you to have like 10 or 15-minute appointments. But obviously, some patients are more complicated and need more time. Then you end up running over, or someone passes out in your waiting room, and it's like set up for failure or losing battle all the time. Want to give the best care, spend the most time with the patients, but then run behind, and then the next patient's angry. It's just so the fact that you kind of have the freedom to see how much time each person needs.
It is nice, but what ends up happening is that a lot of Canadian doctors will, because it is a fee for service, so they'll still cram patients, right? So I see patients, especially new consults, like 30 to 45 minutes, depending on like how complex I think it's going to be. But you get a lot of specialists who will still cram 15-minute consults. So you wait 6 months to see an orthopedic surgeon, sometimes longer, and they come in, they see for all of 30 seconds, and you're out, right? And it's
the same thing that happens here.
Yeah, but it's like the wait time too, right? So you've been waiting, just like my wait times are anywhere from 2 months to 6 months. So patients are waiting 6 months to see me. Yeah, patients are waiting 6 months to see me. I feel that you need to give them at least more than 10 minutes.
Right, because they waited
so damn long to see you.
Right. If you could change one thing about the way you practice or the way the system is, what would that be?
The thing with the system in Canada is that because it's a socialized system, there's a lot of red tape. So, which protects against things like, insurance companies coming in and what's happening, in the States. But too much red tape, too much too many red tape and just too many barriers. So we don't get things that can actually help patients, right? So we're still stuck doing like steroid injections for knee pain. But we know like steroid injections aren't great long term, right? Yeah, sure, they can help short term. So what else do you offer patients and all these other treatments that are, that you hear about in the States, and like I have some colleagues doing here, and like all your pain procedures, you just don't have those options.
So like for knee pain, if that, let's say post-op knee pain, and did it get better after a total knee replacement? There's no options. Like there's no ablations.
So yes, ablations I have sent for, but even some of the pain clinics don't do them. So like I have good relationships with some pain clinics in the area, and I send patients to the right people. But it's a lot of it was trying to find these people and try to find these pain doctors who are like willing to do this, who actually do it as regular practice.
Do you ever have patients like ask about clinical tours and things because of that? Like, do they ask you about, oh, what are the other options that potentially aren't available here in another country?
Yeah.
I'll actually do that.
I tell patients about what you do all the time. I'm like, I have colleagues in the States, and I have
one colleague.
I have one colleague. So anything that's kind of new and innovative, I feel like it just gets squashed in Canada.
So we talked about you recently are planning to expand your clinic.
Yes.
Which I think is super exciting.
Yeah.
You tell me about the dream you and your friend Ricky had as young college students.
Young college students. So we both did kinesiology, and since like 2005, 2006. We said that one day, it'd be so cool if we open a clinic together, maybe a training type of facility, working with like athletes and things like that. This is when you're like young and naive and thinking it's very easy and very straightforward. And so my buddy Ricky, he went the chiropractic route, got lots of accolades, lots of extra training, ended up being the chiropractor for Athletics Canada. Went to Tokyo for the Paralympics. Yeah, so he was the main chiro there. And then in 2022, we opened up our clinic. It's called Heal Space in Toronto, and
look them up.
Yeah, and a small clinic. We said like, let's just see if we can make this, if it's possible, if it's viable. And so we started then, and then he was doing a lot of the work, and a couple years later I started coming on a little bit more, and now we're now we're expanding. So we are going to be moving to a bigger location just down the street from where we are now, but we're trying to get other practitioners involved and building like a training spot in the basement area so we can actually train and rehab our patients properly. And we're excited.
So last time I saw you, I think is when you came to visit me in Florida, and I injected your spine. How are you feeling?
I still have numbness. So
you're telling me it didn't work.
It didn't. Well,
thanks.
Didn't help with the numbness, but I think, my back pain was better.
That's good. How long did that take?
What? How long did?
Yeah, because PRP, they would say 3 months, but
it took I felt better after like 6 weeks, but I came all the way down because I don't trust anyone in Canada to do it.
You can do it again. Maybe you just need to do it again. Seal up that tear. Would you ever do it again? Do you recommend it?
PRP into the disc?
Yeah.
Oh God, it felt like my spine was going to explode. So if you tell me that I need to do it again, I would do it again.
Would you do the sedation this time?
No, I'll just couldn't embarrass. No, I'd get you to do it again. Whatever you say, I trust you with my spine.
What's the most common injury that you see in Canada?
So for my practice, I see a lot of arthritis. Again, that's probably because orthos are backed up, so a lot of people are not getting replacements, and COVID made that a lot worse. We had a large backlog on hip and knee replacements. So mainly what I see is, a lot of hip and knee arthritis.
Do you see a lot less obesity in Canada compared to the U.S.?
Yes.
Wow, no hesitation.
A lot less. A lot less.
Do you think climate has anything to do with that? I've been here every time it's winter. patients say they have so much more pain because it's cold.
Yeah, patients that definitely tend to complain more in the winter. Their knees act up or their hips act up when it's
snowbirds.
Lots of snowbirds.
Yeah,
Lots of snowbirds. Florida. They'll go to Florida. You're not going to help everyone, and a lot of the things are, again, from where in my field, a lot of the things have to be on the patient, right? Like the patient, if you just do an injection and tell the patient to go on their way, it's most likely going to come back, right? Patients are not, you have to encourage doing exercises and
Is there a limit in Canada with how many steroid injections you can do? Like Medicare limits to 4 a year. Do you have the same thing up there?
No, I don't have a limit, but I have my own limits, like with patients, right? I generally, if the patient's younger, I generally advise, 3 in an area in a lifetime.
Lifetime?
Yeah, I'm pretty conservative with it. Then before we try to find something else. If someone's older, like if they're over 80, then I don't care. Then I do 3.
Like they're like 80 or 90.
I do 3. Yeah, then it's whatever. Then I don't.
Are you really worried about
no,
steroid side effects?
No. Then I just say as many as
you can have as many steroid injections as you want.
Yeah.
You've heard it.
So
in Canada, like a lot of the kind of controlled and recreational drugs here are regulated in Canada. Does that mean you use more? I mean, you were saying that yourself, like there's kind of limited options when you reach the end of steroid injections because there's not as many advanced procedures. So do you feel like you rely or educate more about cannabis use, psychedelics, psilocybin? Is that a part of practice since it's a little more controlled?
So it's the rules in Canada at least have been becoming more relaxed. So cannabis is legal across the country. Psilocybin is not, but I think in West it may be legal there, or deregulated, decriminalized, right? In BC, in Vancouver.
Okay.
And so, part of our practice, people have asked me, if they should use it. I have to say, I can't formally recommend that you use something like this.
How about like IV ketamine?
IV ketamine is being used for pain. So that's actually one thing that they are doing.
Is that covered under?
It is covered under
insurance and by the government.
By the government. So for chronic pain, and I get a lot of flyers and faxes that there's all these IV ketamine clinics that are popping up. So that's becoming more popular. I've had patients ask me about that as well too, and I say if speak to your pain doctor, and if they're recommending it, it's worth trying.
Do you find running the business is actually more frustrating on the medicine side or more stressful?
It's different. There's different challenges, but I do think it keeps it exciting. I think as doctors, we were talking about that yesterday, can kind of get boring just doing the same clinical thing every single day. I mean, you get to do fun procedures. I don't do as many, but keeping it interesting is like being a business owner. It's just different. It's just different. So, but it can be frustrating at times, with this new renovation, with talking with contractors and architects, and kind of getting everyone on the same page can be frustrating, but you want things done quickly. But
that'd be my problem if I was in that position.
Yeah, you want everything done quickly.
I do.
And you have zero patience.
Thank you.
You have zero patience, so.
Know me so well, Kevin.
It's hard. Like for Ricky, I have to tell him sometimes to be patient, and because he's there all the time, whereas I'm kind of bouncing around all the other clinics. But yes, getting things done, you would be very patient.
One piece of advice that you have for residents and fellows who are thinking about their future, owning a business, starting a practice, or just working somewhere, what is one thing that you wish someone told you?
Well, I think the best piece of advice that I have would be to, again, we were talking about yesterday, figure out what you want. What you want in your life, how it fits your life, and kind of go after that and try to build your practice around that. Business ownership isn't for everyone. It's depending on like the type of practice that you do, the type of physician you are. If you have a family, how involved you want to be. You have to really figure out what you want to do, and not just with your career and just with medicine, and create that, because really what's going to be the long term, like it's going to keep you doing this, is as long as you're at least somewhat happy. If you're miserable in your career, you're going to burn out. You're going to hate your life, which is something that you don't want to do. And by figuring out kind of where you need to be too. So
do you feel like practicing in Canada is less frustrating than it would be in the States?
Absolutely, that's frustrating.
Yeah,
that's frustrating.